Hello, my name is Dr. Sujata Datta and I'm one of the consultants attached to Bhagirathi Neotia Hospital. Today we're going to talk about postnatal care. Postnatal care is the care of the mother after the birth of the baby. And in my 15 years of practice I found that this is probably the aspect of care that's least talked about in pregnancy, because everyone concentrates on what's going to happen at the delivery and during the delivery, but once the mother goes home with the baby, she's left to fend for herself with not much guidance or support, except from her family members. So we just thought we'd talk about a few points to give her tips as to how to go about it. And there are 2 or 3 aspects that you need to take into account. The most important one, of course, is wound care. Whether it be a cesarean section or a normal delivery, there's very likely to be a cut on your body somewhere. Now, if it's a cesarean section wound, then it's likely to be at the lower half of your abdomen, and the initial dressing would be done from the hospital. These days we do subcuticular sutures, which means it's all under the skin, the stitches, and so you'll be pleased to know that they don't require a formal visit for stitch removal. All these stitches get absorbed by themselves and you're left with a cosmetically beautiful scar. But how do you look after it once you go home? What you have to do is be very good with hand washing, because this is the biggest problem you would face with wound infection. Infection always goes from fingertips, and therefore each time you dress the wound or touch the wound, it's essential that you clean your hands with soap. There is no real need after the first 3 to 5 days to keep it covered. You should wear loose garments so that there is no friction between the wound and your clothes, and allow it to dry in the air. You can have a normal shower, but it's probably best to avoid things like soap and oil in the initial 2 to 3 weeks to allow the wound to heal properly, following which you can go back to using your normal cosmetics and deodorants, etc. During cleanup. Initially, however, we do require to keep it nicely covered and make sure that there's no unsterile thing that comes in touch with it. And if you find any swelling or redness or discharge that's coming from the wound, you must visit your doctor, who will then take a little swab from it to check for any bugs which need to be treated and give you a course of antibiotics so that the infection doesn't go into the deeper layers. If it's a vaginal delivery that you've had, you might have had a small tear or a small cut, which is called an episiotomy, which helps the baby come out. And you will need to take painkillers for both these type of incisions, let's say, to stop yourself from feeling all the pain that is associated with any cut. And the duration of medicine will probably last for about 7 days or so, following which you'll be comfortable enough not to use it on a regular basis. There is also something called sitz bath, which means you take a tub of water, you fill it up with warm water, you put a little bit of antiseptic solution in it, and you sit in that water for 5 to 10 minutes if you've had a normal delivery with a cut, to allow all the blood and the discharge to be washed off that area, to keep you comfortable and prevent infection. This taken once or twice a day would add a lot to how comfortable you feel after the delivery. The other things we need to talk about is, of course, breastfeeding, which is the most important activity that a woman has to concentrate on after delivery. And essentially, demand feed is what we recommend now. So whenever the baby wakes up and cries, you need to feed it in addition to changing the diapers, etc. And this would be on an average every 2.5 to 3 hours. But when you're doing this, you have to remember that the majority constituent of breast milk is water. So every time you breastfeed, you need to drink a lot of water, probably about ½ a liter each time, to make sure that your milk supply is there in abundance and you don't get constipated. Also, taking a little bit of calcium whilst you're breastfeeding would keep your bones strong and healthy, and that is the only medicine that you need to carry on taking while breastfeeding. The other thing we touch on is contraception, because once you've delivered a baby and when your periods come back, and sometimes even before they've actually settled into a regular pattern, you might need contraception to prevent a sudden unwanted pregnancy. And there are some special tablets, special pills that can be given in addition to the barrier methods such as condoms, which we all know about, that would not interfere with breastfeeding but would also keep you protected against an unwanted pregnancy. And your doctor should be able to prescribe that for you. A lot of patients ask me about belts, and belts are something that you can use after the womb's healed. And what it does, it helps give you a little bit of additional support to the bulge that you have, because it does take about 6 weeks to 8 weeks for the uterus to go back to its normal small size in the pelvis. And so that big bump that you had before pregnancy is likely to persist for a while afterwards as well. But you would be deluding yourself if you think that just putting on a belt is going to make your abdomen go back to where it was and make your abdomen look nice and taut. For that, there are postnatal exercises which need to be started from about 6 to 8 weeks once the wound has healed properly. And there are various postnatal exercises, mostly concentrating on toning the abdominal muscles to try and get that bulge out of the system. And obviously regular exercise, healthy eating habits, a balanced diet is equally important in achieving a long-term healthy look.